My name is Dr Osendi. I work in the Department of Health. I head Division of Family Health in the Department of Health. So what we're here today is for social behavior change, as to train the healthcare workers to be TOTs, train of trainers, to ensure that they are able to cascade the same information to other colleagues. You realize that social behavior change is key. Social behavior change and communication. I always add a C because communication is key to ensure that we are able to reach our targeted audience so that they can come for our services in our facilities. Vihiga County uptake of services is high, but we are not at the level that we really need that uptake to be. We are expected to be around 100%. Probably we are doing around 80 to 90%, which we still have a gap in, meaning that we still have a gap in communication. And as healthcare workers, we know that they are the agents of change. They are the people who will be able to give information to the community, to the stakeholders, and to everyone they meet, to the clients. So they really need to be given the right information so that they can be able to know how to interact with the clients, how to interact with the patients at the facility level. Because the most important thing is the interpersonal communication is very key in issues of social behavior change. The way they treat the clients, the way they treat the patients at the facility level, the way they interact with community members in the community gives a whole picture of what is a reflection to the services that we offer. So when we improve on our communication at facility level, it means the communication, the uptake of our services will be high, because the attitude that we have as service providers, the information that we give, the care that we give with dignity, the care that we give with empathy, the active listening, and all aspects of good communication, when they come out of us, then it means the community appreciates it and they'll be able to come and offer services. And it is very key, because we are looking at right now for this partnership we are working together is just to ensure that immunization uptake goes high. And when a child is taken care of the age of under 5, the immunization, then we are looking at the greater a child who is growing up without infection, without more diseases. And also we are improving the welfare of the whole population, because when we immunize against diseases like poliomyelitis, BCG, against tuberculosis, we are preventing a whole society and a whole community. And that is why it is very important that we tailor our messages in a way that is accommodative, in a way that is able to reach the larger audience, in a way that we can pass information in all aspects, whether in church, whether at facility level, whether in the community, because healthcare workers interact with people at all levels in the community. And that is why it is important for this training to ensure that wherever we had gaps, we are able to mend the gaps and ensure that we have good service delivery. Our services, they are free in our facilities, and specifically the preventive services. So for immunization services, my call is for everyone, that is the religious leaders, the top leadership, that is executive, the MCAs, parents, healthcare providers, and all the stakeholders, just to be able to preach the message that the immunizations the children prevent, it is well to prevent these diseases with the immunization, and they are free, and their children will be taken care of. So it is a call for all of us to stand up and say immunization works, and in real it works. So let us call it it works. Spread the information in all avenues that we have access to. Spread the information to all people so that everyone can partake of it and make it a gospel.